Well, I think established different milestones, and I think we still have a big job to do as far as chronic disease, non-transmittable chronic diseases in our region. I think for the near future, mental health becomes a big issue. Also, in the chronic diseases, I believe we have enough examples that where we can move forward on. We have a couple of organizations that will play key roles. I think CARFA will be one of them, and also the PACO, the Pan American Conference on Obesity. I think childhood obesity and obesity in general are the major drivers in our region of the world, and also in our continent. And we have now seen a way to be able to fight this disease and fight the chronic diseases. And it requires that we put our efforts and concentrate our efforts. And that means that we have to have cooperation of the education, infrastructure, I mean real cooperation, real building. And we have to also kind of focus ourselves in a certain way where, as in Aruba, we put up a institute specifically to manage that. So the IBISA is an institute for health and movement, and it really focuses on monitoring, screening, prevention and health promotion on NCDs specifically, and that's all they do. So this institute moves our island. And what we've seen is that with a concerted effort like that and bringing all the partners together, this institute is also a platform where all partners, the private sector, all the different ministries, all the different NGOs come together to really together plot the way to the future, schooling. And from there, we have change. From there, we see that we are able to arrest the growth of obesity. From there, we're able to see that movement on our island went from 9% to 39% in 4 years. So that concerted effort, I think, is a key issue. Universal health coverage is access to care by everyone, not differentiating from how much money they make or their ethnicity or where they come to the island or country. Has to provide that for everyone, all of its citizens, at the same level. I believe that universal care also goes beyond that. And when someone is incapacitated and covers that person for the rest of their lives. So it's a real broad concept, and it's as broad as you want to go. We have adapted a system similar to that of the Netherlands because we're part of the Netherlands, but also you look in the Scandinavian countries is where they have the highest level of universal care, and I think that's critical. But to manage the universal care is the other key. We have to look at a universal care that is around 9% of our GDP, with a growth that we're managing around 4%. If you're able to do that and give everyone coverage and basically take care of everyone, then you're on the right path. Which means also that you really have to manage what you do in your country, what specialties you have in your country, what do you send out. It requires a cooperation with multiple countries to be able to perform this, to be able to give this to your patients and to your population. It also requires that you, depending where you are, that your primary care is very strong and very broad. To do this, you have to look at your finances very, very closely. You have to look at medication. Luckily, we have a lot of generics coming into the field. And so a mix of generics coming into the field and new medicines have to be evaluated on a continuous basis. And you have to have the controls. And in some ways, I think one of the things that we've done is introduced an electronic patient file system throughout our whole system. So all our primary healthcare practitioners have electronic file systems that they're able to move. We're able to look at these and see where we're still lacking. We're able to move faster because of the electronic file systems. We're able to analyze populations better. We're able to do a health monitor every 4 years that indicates and shows us where we stand as a country so that we can set our priorities, the new government's coming in. And it requires a continuous calculation and resetting of where your goals are and where you're going. Um, but in the end, you have to pay for it. And so, in paying for it, you have to determine two things. One, how much money are you willing to put in? And on the other side, how ample do you want your package to be as a universal care? Is it basic care and then add-ons? How do you do that? How do you also create a stop for abuse? In some of the countries, you will find that people will abuse the system because it is free. So all these are challenges that we're facing day to day and that we look at and analyze to move forward. I think Paho's doing a good job. I think one of the things that we've started with Paho, which is new for us, is that really to invite them in and to monitor and evaluate 4 years of work and really look with us candidly and the different departments at what went well, what are our next challenges, where can we use some help, and together I think with agencies like PACO, Pan American Center for Obesity, CARFA, be able to then, with the tools, start moving in the right direction. But it takes an evaluation from outside and a monitoring from outside to help countries move in the right direction. I think that's going to be PAHO's major future work with the countries, and really saying, okay, we have the Millennium Goals, we know what we need to do for NCDs, who's doing it, where are we doing it, and are they really doing it? Where are their bottlenecks? Where are they filling, and how can we fill that in? And so I think that's the next challenge.